Well, today's Ask the Doctor segment all about colon cancer. I'm joined by Dr. Michael Passarella from Shelby Baptist Medical Center, here to take your calls. Give us a call right now if you have a question about colon cancer, 741-9272. That's 741-9272. Just to get us started, colon cancer is one of those things that people don't talk about as much. We don't seem to have as high an awareness about it. What do people need to know about it?
Well, I think it's important to know it's one of the most common cancers that we deal with. It's actually the third most common cancer in both men and women in this country. Over 140,000 new cases diagnosed each year and 50,000 deaths each year. But it's a cancer that's preventable in many cases, and even when we don't prevent it, it's a cancer that we can treat successfully if we catch it early enough. And that's why we really try to emphasize screening. And it's a cancer that can be silent, meaning it can sometimes, not present with symptoms. And so that's why it's important to have your colonoscopy done as a screening measure to try to prevent and or catch the cancer early.
Okay. And the screening recommendations are at 50?
Yes, in most cases. The general recommendation is to begin or have your first colonoscopy done at age 50. Some people might be at higher risk. For instance, somebody with a family history, a family member with colon cancer might need to be screened earlier. That's something that their physician would be able to tell them no.
Okay, we have our first caller. Norman, calling with a question. What's your question?
Yes, good afternoon. I'm 66 years old, and I've had 2 colonoscopies, but the last one I had was in 2008. But my primary care doctor is telling me I'm not due until 2018. Does that sound normal?
That does sound normal. If you had a colonoscopy done in 2008 and polyps were not found, or it was a normal colonoscopy, generally we would recommend follow-up in 10 years. Now, if you had polyps or other abnormalities, that might require a colonoscopy sooner than 10 years. But if he's telling you 2018, that sounds correct, assuming you had a normal colonoscopy.
Okay. Our next caller, Barbara. Barbara, what's your question? Have we got Barbara? I think we lost Barbara. Barbara, do we have you back? What is your question?
Yes, my mother and my father, they passed of colon cancer, and my mother had colon and ovarian cancer, and so I'm 64 now. And how often should I be checked? Because both of them passed away from that cancer,
Yes, ma'am, that's a good question. Generally, with a family history and direct family members or first-degree family members, such as your mother and your father, we would recommend a colonoscopy every 5 years in that case, even if you had a normal colonoscopy, because we might consider you at a higher risk of developing colon cancer because you do have family members.
Okay. One more question from Kevin. Kevin, what's your question?
Hey, my question, I'm 26 years old. I have no medical insurance, and I've been diagnosed with ulcerative colitis. Okay, I've passed blood a lot here recently. I've been to Shelby ER, and they send me to a gastro, but I have no insurance to cover it. Therefore, I can't get a colonoscopy done. So, how would I get seen and taken care of?
No, and it's a good question. There are programs that, whether it's Shelby Hospital or any physician should be able to help you out in order to get that colonoscopy done. And having ulcerative colitis is something that really does need to be treated with everyday medicines. And so I think it's really important that you do try to get in with either a physician or gastroenterologist. You're more than welcome to come see me in my office, and we can try to discuss some of those programs to get you on the right medicines.
Okay, bottom line, you know something's going on, you feel something funny, get it checked out.
Absolutely.
Dr. Passarella, thanks for being with us. We appreciate it.